Dr. Rohit Chakraborty, an environmental public health specialist in air quality and public health at the UK Health Security Agency, who will share with us news of some exciting and very helpful work that the UKHSA are doing on domestic burning. Over to you, Rohit.
Hiya. Hi, I'm Rohit from UKHSA. Let's just jump in. No time to lose. First slide. Okay. So I'm from UKHSA, and we have been doing some work on wood burning previously. So I'll just start with what we've already done. So some of our previous systematic reviews gives us some crucial insights into wood burning health impacts. So these two papers are quite important. One of them is for the insights for children, and other one is for more adults. So the indoor exposure for the children, there wasn't they didn't show any significant association with wheeze or cough, but outdoor exposure does tell a different story. So for example, studies have found positive associations with lower infections, lower respiratory infections, otitis, things like that. But for adults, the evidence is much more definitive, and we did see increased risk of lung cancer, COPD. There was particularly concerning was the high respiratory mortality risk associated. So this was a study. These both were some previous work, and it predates me joining UKHSA. But next slide, please. The new review we are doing currently is updating these evidence, and we are aiming by end of this financial year, by March, we'll be updating and publishing a government report on and showing the link between wood stoves and our health impacts. So currently what we're doing is like expanding the review and addressing some of the previous limitations that are on the right side. So previous studies had problems with not enough controlled exposure studies, not enough monitoring, and it was difficult to link sometimes because of different variables. It's hard to sometimes pinpoint if it's just the outdoor exposure reduced to wood stoves or something else. But we are expanding the literature now. There are some epidemiological evidence to include other cardiovascular outcomes, cancer risk that can be directly attributed towards smoke. And another crucial addition is the integration of toxicological evidence through human exposure. So I think that will be good. What kind of this is done by the whole team, not just me, by the way. So, but what I think is good about this review is quite valuable how it bridges the gap between, say, the toxicological mechanisms and the epidemiological findings. So I think it sort of establishes this biological plausibility and exploring that causal pathways. So we definitely understand now and say, okay, solid fuel exposure does affect health, and we are not a regulatory body, but this evidence I think is going to be really crucial for the government. Next slide, please. Moving on from our UKHSA work, this is slightly different, and it predates me joining UKHSA. During my PhD, I've done some wood burning monitoring work with Dr. James Hayden from University of Nottingham. So we used to monitor air quality in homes, and now we have created this sort of a research tool which kind of puts evidence into practice, let's say. So it's like a real-time PM network. It will provide alerts, and can you have a small click, please? We can put postcode and another click, please. Thank you. And it will then give you a update on what's the air quality like, and it sort of gives you a guidance on if you should use your wood stove or not. Because it's such a voluntary system, we don't have the power to enforce anything. It was designed in a way to currently reduce wood burning effects and improve air quality in areas that we can't otherwise control because of how the smoke control areas work right now. Next slide, please. We piloted this in a different way nationally first, and we had some interesting results. Like 92% of our participants received alerts, 70% of them took action by avoiding lighting the stoves at least once. 33% of users who did light the stoves reduced their burning duration by an average of 1.8 hours. So over just 2 weeks, the system prevented 65 stove uses and saved 178 hours of burn time. A single click, please. So what we were trying to achieve from this was sort of say how it can reduce the PM exposure and can, save in healthcare costs or enhance public awareness, because we were trying to see if like internal compliance would be a good thing to have, and then it can be actually enforced later on if it's found useful. Next slide, please. Currently, we are using this burn alert in a more better designed way. We are using it's currently a study with Swansea at Swansea with the Welsh government. But it's more of a much it's methodologically it's much more stronger. We have a better health protection framework to design this. So we have an early warning system for people in blue, which will say even if the air pollution is low, it will change, instead of a green earlier, which would say it's just low. Now it says, okay, it can change if your stoves are lit. If it goes higher, we would channel our messaging towards protecting the more sensitive group, and if it's higher, it will have the more intervention level where we would say definitely don't burn. So next slide, please, and that's my final slide. So it's because of this, how this three-part framework works is also is rooted into this social science and psychology with Dr. James. And his team has designed this actually. It sort of operates along the multiple alert levels from fair to extremely high, but clubbed in different groups. At the prevention stage, we are more focused on monitoring and awareness. The protection stage sort of targets the sensitive groups, like I said, and the intervention would trigger above 20 when we will say, please avoid lighting your stove. So hopefully we are currently very on way on this with this study, and we will soon have some results to share and find out if this is usable, or is it something that can be enforced later on by councils. And for example, any council can use this as a tool and maybe make it more enforceable, because currently it's voluntary, and as we have seen, we are finding it difficult to recruit participants right now, but hopefully that will change. That's it. I think next slide, please. That's probably it. Yeah. Thank you so much.